Top 10 silent signs your arteries are getting blocked. Imagine this. You feel perfectly fine. No chest pain, no shortness of breath, no dramatic warning signs. You're going about your day, maybe sipping your morning coffee or laughing with a friend, completely unaware that inside your body, something dangerous is quietly unfolding. Your arteries might be silently clogging up, inch by inch. It sounds like a scene from a medical thriller, but for millions of people around the world, this is a hidden reality. The scariest part? By the time obvious symptoms show up, serious damage could already be done. Blocked arteries aren't just a problem for the elderly or people who eat fast food every day. They can happen to anyone. Yes, even to those who think they're living a pretty healthy life. And the signs? They're often so subtle that most of us brush them off as just getting older or a bit of stress. Today, we're uncovering the top 10 silent signs that your arteries might be getting blocked. Clues your body is desperately trying to give you before it's too late. Some of these might completely surprise you. If you've ever wondered what's really happening beneath the surface, or if you want to take charge of your health before disaster strikes, this is a video you absolutely can't afford to skip. Stay with me till the end, because the signs we'll reveal could be the wake-up call that saves your life or someone you love. Ready to unlock these hidden signals? Let's dive right in. 1. Erectile Dysfunction, ED. Let's kick things off with a sign that might surprise, and maybe even embarrass, a few of you. Yep, we're talking about erectile dysfunction, or ED. Now before you roll your eyes and click away thinking, hear me out. ED isn't just a bedroom inconvenience or a punchline in late-night jokes. In many cases, it's actually one of the earliest indicators that something's going wrong inside your arteries, particularly the ones supplying blood to your most personal areas. Here's the science behind it. An erection relies heavily on proper blood flow. Your arteries need to deliver blood efficiently and at the right pressure. But when these arteries start to narrow because of plaque buildup, a process known as atherosclerosis, blood can't flow freely. And guess which arteries are among the first to show trouble? The smaller ones in the penis, which are even narrower than the coronary arteries that supply the heart. A landmark study published in the Journal of the American College of Cardiology found that men with ED are significantly more likely to have heart-related problems within 3 to 5 years of the onset of their symptoms. So in a way, ED can actually serve as an early warning system for your heart and overall vascular health. Think of it like a smoke alarm for your arteries. You might not see the fire yet, but the smoke is definitely there. Now, before anyone panics and runs to the pharmacy, remember, ED can have many causes, including stress, anxiety, or even side effects of certain medications. But when it happens consistently, and especially if you're also experiencing other subtle symptoms like fatigue or leg cramps, it's worth talking to your doctor. Lifestyle changes play a massive role in keeping those arteries clear. Maintaining a diet rich in leafy greens, berries, and healthy fats, olive oil, can support vascular health. Regular exercise, at least 150 minutes of moderate activity per week, as recommended by the American Heart Association, also keeps your arteries flexible and free-flowing. So, next time someone cracks a joke about ED, just remember, it's not only about what happens in the bedroom. It might be your body's way of whispering, "Hey buddy, check your arteries before it's too late." 2. Calf pain when walking. Imagine this. You're strolling through the park, enjoying the sunshine, and suddenly you feel a crampy, tight pain in your calf. You stop to rest, and boom, the pain vanishes like it never happened. You might brush it off as muscle fatigue, but in reality, this could be your arteries waving a giant red flag. So what's really going on? When your arteries are healthy, they deliver oxygen-rich blood to your muscles without any trouble. But if plaque is building up, those arteries narrow, limiting blood flow. During exercise or walking, your muscles need more oxygen. If they don't get enough, they protest painfully. According to the American Heart Association, claudication is one of the hallmark signs of peripheral artery disease, PAD, which is basically artery blockage in your limbs, often indicating similar blockages elsewhere, including your heart and brain. In fact, studies show that people with PAD have a significantly higher risk of heart attack and stroke. The worst part? Many people mistake this pain for simple aging or just a Charlie horse, ignoring it for years. But leaving it unchecked can lead to severe complications, including critical limb ischemia, a condition where blood flow is so restricted that it risks tissue death and even amputation. Now, before you start self-diagnosing every ache after a long walk, remember, occasional soreness is normal, especially if you've recently been more active than usual. But if this calf pain happens repeatedly with predictable patterns and improves with rest, it's time for a professional checkup. What can you do to keep those leg arteries happy? First, ditch the cigarettes if you smoke. Smoking is the enemy when it comes to pad and artery health. Next, focus on a balanced diet rich in omega-3 fatty acids, found in fatty fish like salmon, leafy greens, and nuts. Studies have shown that omega-3s help reduce plaque formation and inflammation. Regular walking, ironically enough, is one of the best ways to combat claudication. It encourages the development of collateral blood vessels, essentially helping your body build its own natural bypasses. The general recommendation is to aim for 30 to 45 minutes of supervised exercise at least 3 times a week. In short, don't let your legs suffer in silence. If they're screaming for help, listen closely. Your arteries might be trying to tell you a story you can't afford to ignore. 3. Persistent jaw or neck pain. Most of us have blamed a sore neck or jaw on a bad pillow, too much phone scrolling, or maybe that Epican you tried to hide during a boring meeting. But what if I told you that nagging pain in your jaw or neck could actually be a hidden SOS from your arteries? Here's the kicker. Pain in the jaw or neck, especially when it happens during physical activity or emotional stress and eases with rest, can actually be a sign of angina, which is chest pain caused by reduced blood flow to the heart muscle. But sometimes, this pain doesn't present as classic chest pain. Instead, it radiates to places like the jaw, neck, shoulders, or even the back. According to the American Heart Association, women, in particular, are more likely to experience these atypical symptoms when their heart is in trouble. That's right. It's not always that Hollywood-style clutching of the chest we imagine. For some, it's a subtle ache in the jaw that just won't go away. This type of pain happens because when your coronary arteries are narrowed or partially blocked by plaque, your heart muscle doesn't get enough oxygen-rich blood. Under stress or exertion, the demand for oxygen spikes, and your heart starts protesting, quietly at first, through these unexpected pain signals. A study in Circulation Journal found that many people experiencing these less typical symptoms delayed seeking help, often with tragic outcomes. By the time they did act, the blockage had already caused significant heart damage. Now, don't get me wrong. Not every case of jaw or neck pain is an arterial crisis waiting to happen. It could be TMJ issues, temporomandibular joint disorder, muscle strain, or even dental problems. But if this pain is new, persistent, or linked to exertion or stress, don't just pop an ibuprofen and hope for the best. It's better to get checked and rule out heart issues early. If you're wondering what you can do to lower your risk, here's the good news. You have plenty of control. A heart-healthy diet high in soluble fiber, think oats, beans, and apples, regular aerobic exercise, and stress management techniques all help reduce arterial plaque buildup. Adding certain supplements like CoQ10 may also support cardiovascular health, especially if you're on statin medications, which can deplete this nutrient. The typical dosage is around 100 to 200 milligrams daily, but again, consult your healthcare provider first, especially if you're on any other heart medications. 4. Hair loss on your legs or feet. Now here's a sign that doesn't exactly scream artery problem at first glance. Hair loss on your legs or feet. Yep, it turns out your smooth, hairless calves might not just be the result of friction from skinny jeans or a particularly enthusiastic waxing session. Let's break it down. Our hair follicles depend on a steady blood supply to stay healthy and do their job, which, in this case, means sprouting those little leg hairs you usually ignore. When arteries become clogged, blood flow to your lower extremities gets restricted. Over time, this starves the hair follicles of essential nutrients and oxygen, causing them to shut down production. This phenomenon is often a sign of PAD, the same culprit behind calf pain we talked about earlier. But here's the thing. Hair loss on the legs is often overlooked because, let's be honest, most people don't inspect their shins like a detective examining a crime scene. According to a study published in the Journal of Vascular Surgery, hair loss on the legs, combined with shiny skin, weak pulses in the feet, and slow-growing toenails, are key external markers of significant arterial insufficiency. In some cases, it can precede more serious symptoms like leg pain or non-healing wounds. This is your body's way of quietly saying, "Hey, something's blocking the traffic down here." Ignoring it might mean missing a chance to address early vascular disease before it turns into something severe. Now, if you're suddenly panicking and inspecting your legs in the mirror, don't freak out just yet. Hair loss can also be caused by other factors like hormonal changes, certain skin conditions. But if it's persistent, patchy, and you notice other changes like cool skin temperature or pale toes, it's time to chat with your doctor. To help keep those leg arteries open and flowing, prioritize a diet rich in antioxidants and anti-inflammatory foods. These help combat oxidative stress, which is a major contributor to arterial plaque formation. Regular moderate exercise, especially walking and cycling, boosts circulation and supports overall vascular health. So, next time you notice your legs looking suspiciously smooth, don't just blame it on your razor. Your arteries might be giving you a subtle and surprisingly hairy heads up. 5. Weak or absent pulse in your feet. We check our pulse in our wrists or neck when we're feeling extra healthy or after a cardio session. But have you ever checked your pulse on your feet? Probably not, unless you're a podiatrist or maybe a vampire hunter. But here's the thing. Your foot pulse can reveal a lot about what's happening inside your arteries. Normally, you should be able to feel a strong, steady pulse on the top of your foot, called the dorsalis pedis, and behind your inner ankle, the posterior tibial pulse. If these pulses are weak or completely absent, it might mean blood isn't reaching your feet properly, and that's a big, blinking neon sign of PAD. When arteries get blocked with plaque, blood flow to the extremities diminishes. Over time, this causes the pulses in your feet to fade. According to the American College of Cardiology, weak foot pulses are one of the most reliable early clinical signs of PAD. They even recommend checking these pulses as part of routine vascular assessments, especially for people over 50 or those with diabetes or smoking histories. Why does this matter? Well, your feet are the furthest point from your heart, so they rely on a smooth, unobstructed highway of arteries to stay nourished. When that supply line gets clogged, your foot tissues starve, making you more vulnerable to infections, ulcers, and in extreme cases, even gangrene. Yikes. Some people don't notice at all until they develop non-healing sores or feel an unusual coldness in one foot compared to the other. By then, serious damage might already be in motion. Here's the good news. You can be proactive. Check your foot pulses once in a while. It's easy. Just lightly press on the top of your foot, in line with your big toe. You should feel a little rhythmic bump. If it's faint or missing on one side, bring it up with your doctor. Lifestyle steps to keep those pulses strong. Prioritize a Mediterranean-style diet, loaded with veggies, whole grains, nuts, and fish. This diet has been shown to reduce the progression of atherosclerosis and improve overall vascular function. 6. Frequent dizziness or lightheadedness. We've all had that moment. You jump up from the couch to grab a snack, and suddenly the room does its best impression of a carnival ride. You grab the wall, blame it on getting older, and move on. But when dizziness or lightheadedness happens often, and not just when you rocket out of bed, it could be a sign that your arteries are sending out a distress signal. Here's why. Your brain needs a constant, steady supply of oxygen-rich blood to function. When arteries supplying your brain start narrowing from plaque buildup, blood flow gets restricted. As a result, your brain doesn't get the fuel it needs, leading to those annoying and sometimes dangerous dizzy spells. This condition is often a precursor to carotid artery disease, which can significantly increase your risk of stroke. In fact, a study published in Stroke Journal showed that people with significant carotid artery narrowing are at much higher risk of experiencing transient ischemic attacks, TIAs, often called mini-strokes. These TIAs can manifest as brief episodes of dizziness, weakness, or even vision changes. Before you freak out and start imagining every head rush as a stroke in progress, remember, dizziness can be caused by dehydration, inner ear problems, anemia, or low blood sugar. But if it's happening frequently, unpredictably, or alongside other symptoms like blurred vision, sudden weakness, or trouble speaking, it's time to call on the pros. Want to help keep your carotid arteries and brain happy? Start with diet. Aim for foods rich in nitrates, like beets, arugula, and spinach, which help widen blood vessels and improve circulation. Also, potassium-rich foods help maintain healthy blood pressure, which in turn supports smooth blood flow to your brain. So, the next time your head decides to spin without your permission, don't just chalk it up to standing too quickly. Your arteries might be trying to get your attention before things get serious. Listen closely. Your brain will thank you. 7. Slow healing wounds on your feet or toes. Most of us think of cuts and scrapes as temporary nuisances, something a little antiseptic and a Band-Aid can handle. But if those tiny nicks on your feet or toes start taking forever to heal, your arteries might be trying to tell you they're in trouble. Here's the science behind it. When you injure your skin, your body rushes to repair the area using fresh, oxygen-rich blood. Arteries act as delivery trucks, bringing all the healing supplies, oxygen, nutrients, white blood cells, to the scene. But if those arteries are narrowed or blocked because of plaque buildup, the road is jammed. This reduced blood flow means your wounds heal at a snail's pace. Or worse, they might not heal at all. According to a study published in Circulation, poor wound healing on the lower extremities is one of the most telling signs of advanced PAD. In severe cases, it can lead to ulcers or serious infections that put you at risk of gangrene or even amputation. Here's a little perspective. Slow healing foot wounds aren't just for diabetics. Though people with diabetes do have a higher risk due to their additional blood vessels and nerve issues. Even without diabetes, blocked arteries alone can cause this problem. Now, before you panic over every paper cut, remember, location matters. We're talking specifically about the feet and toes here, where circulation is naturally weaker, especially if you have PAD. What can you do to keep those feet healing like they should? Focus on keeping your blood vessels healthy from head to toe. Prioritize foods high in vitamin C, which play a vital role in collagen formation and wound healing. Zinc is another star player, found in pumpkin seeds, chickpeas, and cashews. It helps support skin repair and immune defense. So, think of your wounds like little health reporters. If they're dragging their feet on the job, they might be tipping you off to a bigger headline. Your arteries need attention. Stat. 8. Shortness of breath during routine activities. We all know that gasping for air after sprinting to catch the bus or chasing your dog across the park is pretty normal. But what if you find yourself breathless just from climbing a single flight of stairs or carrying groceries into the kitchen? That's not just being out of shape. It might be your arteries crying out for help. Here's what's really going on. Your heart and lungs work as a dynamic duo to keep your body fueled with oxygen. When your coronary arteries, the vessels that supply blood directly to your heart muscle, get blocked with plaque, your heart doesn't receive enough oxygen-rich blood, especially during physical exertion. This is known as ischemia, and one of the first signs your heart is struggling is unexplained shortness of breath. According to a study published in the Journal of the American College of Cardiology, shortness of breath can be an early warning sign of CAD, even before any chest pain shows up. In fact, some patients never experience classic chest pain at all. Instead, they just feel like they've run a marathon after folding laundry. Why does this happen? As you start moving, your muscles and heart demand more oxygen. If the arteries are clogged, the heart struggles to pump efficiently, and the lungs try to compensate by working harder. Cue the huffing and puffing. If you're thinking, I just need to get to the gym more, pause for a second. While regular exercise is crucial, unexplained breathlessness, especially when paired with fatigue, lightheadedness, or swelling in the legs, deserves serious attention. What can you do to protect those arteries and breathe easy? First, manage your cholesterol levels. A diet low in trans fats and rich in fiber helps keep bad LDL cholesterol in check. Nuts, especially walnuts and almonds, contain healthy fats that support heart health. 9. Blue or purple toes. All right, let's get colorful, literally. If you've ever looked down and noticed your toes taking on a weird bluish or purplish tint, your arteries might be staging a silent protest. This condition is called blue toe syndrome, and despite its almost cute-sounding name, it's a serious sign that something is blocking blood flow to your toes. Essentially, tiny bits of plaque or cholesterol crystals break loose from larger arteries and travel down to the smaller vessels in your feet. These little rogue fragments can lodge themselves in your tiny toe arteries, cutting off blood supply and turning your toes an alarming shade of blue or purple. The Cleveland Clinic describes blue toe syndrome as a classic clue to systemic atherosclerosis, meaning widespread artery blockages that might not be limited to your feet. If the arteries in your legs and feet are compromised, there's a good chance your heart and brain arteries are too. Unlike the gradual changes seen with peripheral artery disease, blue toe syndrome can appear suddenly. You might notice one or more toes turning dark, feeling cold to the touch, and sometimes becoming painful or tender. Some patients even describe a pins and needles feeling before the discoloration sets in. What can you do to keep your toes their normal, happy color? First and foremost, stop smoking if you do. Smoking drastically accelerates plaque buildup and increases the risk of cholesterol debris breaking off. Focus on an anti-inflammatory diet. Foods rich in polyphenol, such as berries, dark chocolate, yes, permission granted in moderation, and green tea, can help reduce overall inflammation and support arterial health. So, next time you notice your toes are channeling their inner blueberry vibe, don't just throw on thicker socks. It could be your body's dramatic way of telling you to check your arteries before they stage an even bigger protest. 10. Fatigue that won't quit. We all know what it feels like to be tired after pulling an all-nighter, juggling a million tasks, or binge-watching an entire season of your favorite show in one weekend. But if you're dragging yourself through the day, constantly yawning, and feeling wiped out even after a full night's sleep, your arteries might be sending out a final, desperate smoke signal. This type of persistent, unexplained fatigue can be a sign that your heart, and the arteries feeding it, are struggling. Here's why. When your coronary arteries are narrowed or blocked, your heart doesn't receive enough oxygen-rich blood to pump effectively. As a result, your body's tissues and organs also get less oxygen, leaving you feeling like your battery is permanently stuck at 5%. A study published in the European Heart Journal found that chronic fatigue, particularly in women, is often overlooked as a symptom of heart disease and blocked arteries. Many women report fatigue as their primary symptom even before experiencing classic chest pain. The problem? We're too quick to blame it on busy schedules, stress, or just getting older. How do you fight back against artery-related fatigue? Start by focusing on heart-friendly nutrition. Foods high in monounsaturated fats help improve blood lipid profiles and keep those arteries more open and flexible. Whole grains and legumes support steady energy levels and promote better circulation. Another key strategy? Stress management. Chronic stress increases inflammation and can worsen plaque buildup. So whether it's through meditation, yoga, gardening, find ways to chill that genuinely recharge you, not just mask the fatigue with quick fixes. So, if you're constantly running on empty despite doing all the right things, don't ignore it. Your fatigue might be more than just a sign you need a vacation. It could be your arteries waving a giant red flag, begging for attention before they throw a full-blown tantrum. And there we have it, 10 silent signs that your arteries might be crying out for help, even when you feel perfectly fine. Pretty eye-opening, right? We've learned that your body is like a super sophisticated messenger, always sending little clues, whether it's those bluish toes, that stubborn fatigue, or jaw pain you keep brushing off. The big lesson? Ignoring these signals could mean missing the chance to protect your heart and live a longer, more energetic life. But here's the good news. You're not stuck on this path. Every small choice you make today, whether it's swapping that sugary snack for a handful of nuts, adding more greens to your plate, or simply going for a brisk walk after dinner, brings you one step closer to stronger arteries and a healthier, happier you. You don't have to flip your entire life upside down overnight. Real change is built on tiny, steady habits. Think of it like planting seeds. Water them daily, give them sunlight, and with patience, they grow into something incredible. Your health works the same way. Now, I want to hear from you. Have you noticed any of these silent signs in your own life? What steps are you taking to keep your heart and arteries healthy? Drop your experiences and tips in the comments below, because when we share, we inspire each other to do better, and that's how we build a strong, supportive community. If you found this video helpful, go ahead and hit that like button and subscribe.